When you watch TV, you know how it's difficult, if not impossible, not to see commercials for various prescription drugs. The prescription drug business is, of course, big business, way beyond even what you and I purchase at the store. It's big business here in Texas, as in millions of your tax dollars that pay for drugs used by some patients covered by Medicare and Medicaid. For the past few months, KI News Investigates reporter Nancy Wilson has been looking into money pharmaceutical companies give to state agencies and how it's then used by state officials who make decisions about which drugs your tax dollars purchase. It's tonight's KI News Investigates.
We'll say these are the drugs that are first.
This is Dr. Stephen Sean. He works for the state, paid with your tax dollars, working here to make sure kids in the state's custody and other mental health patients get the proper medical treatment they desperately need. He's in charge of making sure patients are getting the right drugs and that those drugs are safe and effective. So why is this man traveling around the country courtesy of pharmaceutical companies that make the very drugs he's paid to evaluate? Dr. Sean is the medical director for the Texas Mental Health Department and oversees tmap, the Texas Medication Algorithm Project. tmap is a step-by-step guide for treating mental illnesses, including which drugs to prescribe and in which order.
The tmap algorithm process is required to be implemented in our system, which consists of state hospital facilities and community centers that are funded by state funds.
We found he made at least 84 trips around the country promoting the benefits of tmap and lobbying other states to adopt the program. So far, about 12 states have signed on. Because the drugs used are some of the most expensive on the market, drug companies stand to make millions. So it's no surprise that pharmaceutical companies would be willing to pay Dr. Sean's travel expenses.
We don't really talk about specific drugs in the algorithm. We'll say these are the drugs that are first line, whatever, but we don't talk about why this drug is better than that drug. The decisions are really based on what the evidence is for both efficacy and safety.
So who decides which drugs are used in tmap? Who decides what's effective and safe? Well, it's done by what's called expert consensus. Now, we found instead of relying on scientific data from clinical studies, the decisions are based on the opinions of a group of selected doctors and researchers. That was the first of many questions we raised after learning most of these experts were also paid consultants for the pharmaceutical industry. For example,
the medications are...
Len Chrisman is a professor at the UT College of Pharmacy. In addition to his university salary, he has a $128,000 a year contract through UT to work on tmap. He's also a consultant for drug makers like Bristol Myers, Janssen, and Pfizer. He is a paid speaker for drug companies like AstraZeneca, Forrest, and Eli Lilly. Those and others have funded some of his research projects. It seems like you have kind of a potential for a conflict, but also it's almost like moonlighting for the pharmaceutical companies. Would that be accurate?
Now, the university allows all faculty a certain percent of release time to do consulting, whether it's private sector, public sector, federal government, or whomever. And, we disclose once a year in terms of who we consult for.
State employees aren't allowed to take fees to work as consultants. Any money made from speaking engagements goes to the state. Sean says money from his speeches goes into a separate account that he is authorized to use on behalf of the department. Records showed that significant deposits by drug companies were for things in addition to Dr. Sean's travel expenses. Over $1 million has gone into the account from companies whose drugs are used in tmap. We compare the amount of money paid to the state with the amount in sales. Records show Pfizer Pharmaceuticals gave the state more than $232,000 for the tmap program. During the same time period, the state of Texas paid more than $233 million for Pfizer's drugs. Janssen Pharmaceuticals gave the state $224,000 for tmap, while sales to the Texas Medicaid patients for its drug Risperdal rang up to more than $272 million. Eli Lilly gave $109,000 to the Mental Health Department, while sales of Zyprexa to the Texas Medicaid system reached $328 million. By law, any donation to a state agency must be approved by the department's board of directors. We looked through years of board records and found while some of the money from the drug companies was approved by the board, Most was not.
Whenever you were going out on these trips and to speak and the funding was coming from the pharmaceutical companies, were you ever aware that it might look like a conflict of interest?
I thought it possibly could, but given the fact that this is how conferences and education works, I didn't think that this was really any different than what was going on anywhere else.
We've been trying to figure out exactly how much money is in that separate account set up for donations from pharmaceutical companies. We also wanted to know how that money was spent. So far, the state has not provided that information. Now, we will continue to investigate that and let you know exactly what we find. Nancy Wilson, KI News Investigates.
The Food and Drug Administration has questions about some of the drugs used in the Texas program. Just last week, it imposed the strictest warnings on antidepressants. The FDA's investigation revealed some of the companies withheld safety information and data that suggests the medications may not be effective in children. A legislative committee will meet Monday to discuss the use of psychiatric medications for children in the state foster care system.